Hello, my name is Cameron Zamanian, a graduate researcher at the Mayo Clinic Neuroinformatics Lab under Dr. Mohamad Bydon. And today I'll be discussing one of our team's projects, which investigates the utilization of social determinants of health codes within neurosurgical practice. So what are social determinants of health? These are the non-clinical factors that influence the health of a patient, including education, family upbringing, and employment. For example, patients without a high school education are more than 5 times more likely to have poorer health outcomes compared to those who do. Fortunately, these metrics are quantifiable, as the Center for Medicare and Medicaid Services has implemented and recommended the use of social determinants of health international classification of disease 10 billing codes to better capture the state of a patient's well-being. Within neurosurgery, we might not always capture these contributory factors due to the complicated nature of neurological diseases. However, these realities demand that we recognize the social determinants of health in order to improve health outcomes in a way that is inclusive and effective. The utilization of these social determinants of health codes within neurosurgery have not yet been characterized. Therefore, our objective in this study was to determine trends in utilization of new social determinants of health ICD-10 billing codes within neurosurgery using a national administrative claims database. The Healthcare Cost Utilization Project National Inpatient Sample was queried from 2016 to 2018 for all admissions in which neurosurgical procedures were performed. Social determinants of health billing code utilization was based on a variety of categories, including education, employment, environmental risk, family upbringing, home insecurity, resource availability, legal issues, and social behaviors. Estimates were then nationalized using discharge weights provided by the HCUP. In total, we found 867,688 admissions in the NIS for our study. From 2016 to 2018, the nationalized percentage of admissions that used any social determinants of health code changed from 2.42 to 2.24%. In addition, education billing codes went from 0.004 to 0.006%. Employment codes went from 0.04 to 0.05%. Environmental risk codes went from 0.24 to 0.34%. Family upbringing codes went from 0.12 to 0.14%. Home insecurity codes went from 0.31 to 0.39%. Resource availability codes went from 0.03 to 0.04%. Legal issue codes went from 0.03 to 0.04%. And social behavior codes went from 1.7 to 1.3%. Ultimately, a linear trend analysis showed that a statistically significant decrease in social determinants of health code utilization was seen during the study period. Despite CMS recommendations, social determinants of health codes are underutilized in neurosurgical practice, with an overall utilization decreasing during our study period. The underutilization of social determinants of health within neurosurgery warrants further investigation to address the disparities, challenges, and inequalities that lead to poor health outcomes. The social determinants of health should be recognized among all specialties and used in healthcare as a tool to create policies to fund communities in poverty, create job opportunities, and improve the environmental constraints that are affecting millions today. If we do this, we may just find a healthcare system that advocates for the health of patients beyond the operating room. Thank you.